My sister Carrie had what most people thought was the perfect life. The perfect husband, the perfect job, the perfect house. She's beautiful. About 3.5 years ago, she got a skin condition, some type of rash.
It was as if someone took a cigarette and put it out on my face. I went to the doctor to treat the sores. After about 2 weeks, the infection did calm down. A couple months later, the whole infection came back like wildfire. The infections would go away and stay at bay for a while, and then they'd flare up. And then they'd go away, and they'd flare up. Over the past 3 years, I've seen 9 different doctors, prescribed 10 different face washes and 15 different ointments and 9 different antibiotics.
I'm not sure if you can see them very well, but the infection just sits in my face.
I don't know what to say to her because I'm not a doctor, so it's just hard because there's nothing I can do for her.
I clean my sores 3 times a day. I don't want them to spread, so I clean each sore with a different side of the Q-tip. I spend 4 to 5 hours a day just washing them.
This has totally taken a toll on her emotionally.
Shortly after my first infection, I lost my home, I lost my job. My husband decided he didn't want to be a husband anymore, and he left me, and I am ready for my life back.
I used to be so outgoing. Now I isolate all the time.
I just want her to be happy. And if she's happy and I get my sister back, then I'll be happy.
We sent Carrie to dermatologist Dr. Sonia Batra to see if there were any answers.
So I know you're here to talk about the skin here on the face.
Yes.
Tell me what's been going on.
It started as a cyst in my nose, and then parts of my face would puff up a lot, and then the skin would break, and then they'd become these large open sores, and so it's just consistently gotten worse.
What's your protocol? Like, let's say one of these spots come up right at the beginning. What do you do to take care of them?
Just washing with water, and then I apply ointment, and then when the infection comes to the head, I wipe it off. I wash it, I reapply ointment. And so I've been trying to get the infection to come out of my skin naturally.
Do you feel like you're trying to squeeze something out?
No.
Or trying to excavate anything?
I'm not extracting or anything, no. Like if I exfoliate and there's dry skin or something, I just take tweezers.
Okay.
And just, I'm not pulling it off, it's
Sure.
it's hanging off.
I'd like to do a couple small biopsies just to
Okay.
see what's going on under the surface of the skin. And then because there's this question about these recurrent infections, I think we should take a tiny piece and send that for something called tissue culture.
Okay.
I'm just ready for this to be done. I'm ready for my life back.
So I'm gonna rest you back. And you're gonna feel a little tiny pinch and some burning here. I'm just gonna have you keep your eyes closed here. And so I'm just gonna put a couple little stitches in. Do you feel anything sharp or uncomfortable here? So this one we'll send for culture. And last stitch. Well done. Great, so that's all. That's it for the biopsies. So we'll get you bandaged up, we'll draw some blood, and then hopefully we'll get you some really good information.
Okay. All right.